Life can feel heavy, like a weight on your chest. That's what major depression can feel like. It's more than just feeling sad or down. It's a serious mental health condition. It affects how you feel, think, and handle daily activities. Imagine feeling a constant sadness that engulfs your entire being. It's a pervasive feeling of hopelessness and despair that lingers for weeks, months, or even years. Simple tasks, once enjoyable, now seem insurmountable. Major depression can drain your energy, leaving you feeling constantly fatigued and lethargic. The things you used to love, your hobbies and passions, no longer spark joy. Instead, they're replaced by a sense of emptiness and apathy. It's crucial to remember that major depression is not a sign of weakness. It's a real illness that requires understanding, compassion, and professional help. Now imagine major depression with an added layer of complexity. This is where psychotic depression comes in. It's a subtype of major depression, but with a crucial difference: psychosis. Psychosis means experiencing things that aren't real. It can involve hallucinations. These are things you see, hear, smell, taste, or feel that aren't actually there. Psychosis can also involve delusions. These are strong beliefs that aren't based in reality. For example, someone might believe they have superpowers or are being followed. Psychotic depression is a serious condition requiring immediate medical attention. The combination of severe depression and psychosis can lead to dangerous behaviors and thoughts. Major depression can manifest in a variety of ways. It's like a chameleon, changing its appearance from person to person. However, some common symptoms help identify its presence. One prominent sign is a persistent low mood. This isn't just a fleeting feeling of sadness. It's a pervasive melancholy that permeates every aspect of life, coloring thoughts, emotions, and behaviors. Loss of interest in activities that once brought joy is another hallmark of major depression. Hobbies, passions, and social interactions lose their appeal, leaving individuals feeling empty and apathetic. Changes in appetite and sleep patterns are also common. Some individuals may experience a decrease in appetite, leading to weight loss. Others might find solace in food, leading to weight gain. Sleep disturbances such as insomnia or excessive sleeping can further disrupt daily routines and exacerbate feelings of fatigue. Psychotic depression shares many symptoms with major depression, but it also has its own unique set of characteristics, primarily centered around psychosis. Hallucinations are a defining feature of psychotic depression. These can involve any of the 5 senses. Auditory hallucinations such as hearing voices are the most common. Visual hallucinations, seeing things that aren't there, are also possible. Delusions are firmly held beliefs that contradict reality. These beliefs can vary widely in content. Someone with psychotic depression might believe they are being persecuted, followed, or that their thoughts are being controlled by external forces. These psychotic symptoms can be incredibly distressing and frightening. They can make it difficult for individuals to distinguish between what is real and what is not, leading to confusion, fear, and behavioral changes. Section 5: Diagnosis. Finding the right path to healing. Getting the right diagnosis is crucial for any illness, especially mental health conditions like major depression and psychotic depression. Accurate diagnosis is the compass that guides treatment and support. Diagnosis usually begins with a conversation. A doctor or mental health professional will want to hear about your symptoms. They'll ask about how long you've been experiencing them. They'll also want to know about your medical history, any family history of mental health conditions, and any medications or substances you're currently using. This information helps them paint a clearer picture of your overall health. Remember, honesty is key during this process. The more information you can provide, the better equipped your doctor or mental health professional will be to make an accurate diagnosis and develop an effective treatment plan. Section 6: Tools of the Trade. How professionals diagnose depression. Diagnosing depression isn't like diagnosing a broken bone. There's no blood test or X-ray. Instead, mental health professionals use a combination of tools and their expertise. One important tool is a clinical interview. This is just a fancy way of saying a conversation. The doctor or therapist will ask you a lot of questions about your feelings, thoughts, and behaviors. They might also use a questionnaire. This helps them get a standardized measure of your symptoms. It's like a ruler for depression. It helps them understand how severe your symptoms are. There's no single test to diagnose depression. It's about putting all the puzzle pieces together: your symptoms, your history, and your current situation. Section 7: shining a light treatment options for major depression. The good news is that major depression is treatable. There's a toolbox full of options, and what works best can differ from person to person. One common tool is therapy. Talking to a therapist can help you understand your thoughts and feelings. It can also give you coping mechanisms to manage your depression. Another tool is medication. Antidepressants can help balance chemicals in the brain that affect mood. It's like adjusting the volume on your emotions. Lifestyle changes are also important. Exercise, a healthy diet, and enough sleep can make a big difference in managing depression. Think of it as building a strong foundation for your mental health. Section 8. Navigating the labyrinth. Treatment for psychotic depression. Psychotic depression, due to its severity, often requires a more intensive approach to treatment compared to major depression. Hospitalization might be necessary, especially in cases where individuals might pose a danger to themselves or others due to their psychotic symptoms. The hospital provides a safe and structured environment for stabilization and intensive treatment. Medication, particularly antipsychotics, is typically a central part of treatment for psychotic depression. Antipsychotics help manage the psychotic symptoms, such as hallucinations and delusions, allowing individuals to think more clearly and rationally. Therapy remains a crucial aspect of treatment. Once the psychotic symptoms are under control, therapy can help individuals process their experiences, develop coping mechanisms for their depression, and work towards recovery. Section 9. The importance of an accurate diagnosis. Why getting it right matters. Imagine going to the doctor with a sore throat. You wouldn't want them to just hand you a bandage and send you on your way. You'd want them to figure out what's causing the sore throat so they can give you the right treatment. The same goes for depression. Major depression and psychotic depression might seem similar on the surface, but they require different approaches to treatment. Getting the wrong diagnosis can lead to delays in receiving appropriate care. It can also mean trying treatments that aren't effective or could even worsen symptoms. That's why it's so important to be open and honest with your doctor or mental health professional. The more information they have, the better equipped they are to guide you toward the right treatment path. Section 10. Who's at risk? Factors that contribute to depression. Depression doesn't discriminate. It can affect anyone, regardless of age, gender, race, or socioeconomic status. However, some factors can increase the risk of developing depression. Genetics can play a role. If you have a family history of depression, you might be more susceptible. It doesn't mean you'll definitely develop it, but it's something to be aware of. Life experiences, particularly stressful or traumatic events, can also contribute to depression. Job loss, the death of a loved one, or experiencing abuse can significantly impact mental health. Physical health issues and certain medications can also play a role. Chronic illnesses or hormonal changes can influence mood and increase the risk of depression. Section 11. A helping hand seeking support and finding hope. Living with depression, whether it's major depression or psychotic depression, can feel isolating. But it's important to remember that you're not alone. There is help available, and recovery is possible. The first step is often the hardest: asking for help. Talk to someone you trust, like a friend, family member, doctor, or therapist. Sharing your experience can be incredibly liberating and is the first step towards getting the support you need. There are also numerous resources available, such as hotlines, support groups, and online forums. These resources can provide a lifeline of support, information, and connection with others who understand what you're going through. Remember, seeking help is a sign of strength, not weakness. It's a testament to your resilience and your commitment to your well-being. Recovery might not be a straight line, but with support and the right treatment, you can navigate the challenges of depression and find hope for a brighter future.